Greetings. Saludos, everyone. On behalf of the National Behavioral Health Association and the National Hispanic and Latino Prevention Technology Transfer Center, we welcome you to our webinar, Suicide Prevention. Everyone can help. Preventing suicide in the Latino community. My name is Pierluigi Mancini. I am the project director for the National Hispanic and Latino Prevention Technology Transfer Center. I will be your host for today's webinar. Before I introduce you to the presenter, here are some brief instructions about today's presentation. This webinar will be recorded and archived for future playback. It will be translated in Spanish and in Portuguese. The lines will be muted throughout the presentation. When we get to the Q&A portion of our webinar, you will have an opportunity to ask questions by typing your questions into the question and answer box, and I will present your questions to our speaker. Although we are not providing continuing education credits for this event, we plan to do so for future events. For this webinar, we can provide you with an electronic certificate of attendance with 1.5 hours of credit upon request when you complete the evaluation. So let's begin. Let us start by introducing the National Hispanic and Latino Prevention Technology Transfer Center that is housed at the National Latino Behavioral Health Association, NALBA. NALBA is a nonprofit organization located in New Mexico. NALBA was established to fill a need for a unified national voice for Latino populations in the behavioral health arena and to bring attention to the great disparities that exist in areas of access, utilization, practice-based research, and effectively trained personnel. Our National Hispanic and Latino Prevention Technology Transfer Center is a part of the PTTC Network, which is an international multidisciplinary resource for professionals in the prevention field. Established in 1993 by the Substance Abuse and Mental Health Services Administration, SAMHSA, the PTTC network is comprised of 10 domestic regional centers, 6 international HIV centers funded by PEPFAR, 2 national focus area centers, and a network coordinating office. Together, the network serves the 50 US states, the District of Columbia, Puerto Rico, the US Virgin Islands, and the Pacific Islands of Guam, American Samoa, Palau, the Marshall Islands, Micronesia, and the Mariana Islands. The international HIV ATTCs serve Vietnam, Southeast Asia, South Africa, and Ukraine. Here you will see a map of the US-based PTTCs. The National Hispanic and Latino Prevention Technology Transfer Center has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. The National Hispanic and Latino PTTC is staffed by myself, Pierluigi Mancini, and I serve as project director. Priscilla Giamasi is our executive administrative assistant, and Dolca Michelle Celaya is our project coordinator. We will be asking you to fill out a brief evaluation at the end of this webinar. This evaluation survey is important to the work we do and provides us the opportunity to improve our training efforts and secure funding to continue our work. Please take a moment to take the survey after we're done. Now it's time to introduce our esteemed colleague, Mrs. Deanna Rosado. Mrs. Deanna Rosado was born in Ohio from Puerto Rican parents, graduated with a BA in Business Education and an MA in Guidance Counseling from the University of Puerto Rico. Deanna is an internationally certified prevention specialist. She worked as a school counselor in elementary, intermediate, and high schools in the public school setting. She's worked as a partnership specialist with the Department of Commerce for 3 years. She was a prevention specialist at CETPA as the project coordinator for the Suicide Prevention Initiative. She started from scratch the Suicide Prevention Coalition in Gwinnett County in the state of Georgia. She coordinated the direction and production of a suicide prevention documentary that aired in Spanish television and won an Emmy in the Southeast. Ms. Rosado afterwards directed the Alcohol Prevention Project in 5 regions in the state of Georgia, concentrating efforts towards the Latino youth, and coordinated the direction and production of a documentary on alcohol prevention, which also won an Emmy in the Southeast. She lastly was the project coordinator for Comprando Rico y Sano, an initiative to foster healthy eating habits within the Latino families. She currently lives in Lawrenceville, Georgia with her husband and have 3 married children and 1 granddaughter. Deanna, welcome. It is a pleasure to have you with us today.
Thank you for having me. It is my pleasure to facilitate this webinar. Thank you very much for the opportunity. Let me start by saying that we are in September and it is Suicide Prevention Month. The first World Suicide Day was held on September 10, 2003, and this presentation will last around 1 hour and a half. And sadly, someone every 40 seconds take their own life according to the World Health Organization, and that is approximately 135 lives during this presentation. Let me take a minute to talk about a little bit of history. In 1970, the National Institute of Mental Health assembles a task force in Phoenix to discuss the status of suicide prevention in the country. It wasn't until 2001 that crisis centers are established nationally. The Substance Abuse and Mental Health Services Administration, SAMHSA, as we all know it, creates the country's first program aimed at serving all persons at risk of suicide in the U.S. via local certified crisis centers. In 2004, a youth suicide prevention grant program is passed, and that is the Garrett Lee Smith Memorial Act, which is created. And in 2012, the National Strategy for Suicide Prevention is created and concludes that the goal of saving lives can only be achieved through a series of coordinated steps. Well, what is suicide and why is a problem? Well, for each death by suicide, 135 people are affected. Suicide, we can define it as the act of intentionally causing one's own death, and it's a major public health problem and a leading cause of death in the United States. The effects of suicide go beyond the person who acts to take his or her own life, because it can have a lasting effect on family, friends, and communities. A suicide survivor is one of the family and friends of someone who has died by suicide. Let's talk a little bit about national statistics. And 47,000 people died by suicide in 2017 alone, more than double than homicide, which was 19,500. And for each death by suicide, 229 seriously considered suicide. And U.S. adolescents and young adults, second leading cause of death according to the CDC. Suicide is a leading cause also of death among college and university students in the United States. Number of deaths by suicide are believed to be higher. I was speaking with a medical examiner here in Gwinnett County in Georgia, and he mentioned a few cases as examples of death that were not ruled as suicide, but suspected as such. One case that comes to my mind is of an old lady who lost her husband of more than 50 years by natural causes, and for some reason couldn't keep up living in her home and was going to move with her son. She owned a cat for 10 plus years, and her son told her that she wasn't able to bring the cat with her, to not bring it with her. So the day before she was supposed to move out, she crashed against a tree in her home street and both her and the cat died on impact. Even though the medical examiner suspected suicide, the death was ruled out as a car accident. And it was sad to see and hear other cases that he was mentioning to me. And regarding suicide rates by age, next slide, please. Between 2008 and 2017, suicide rates increased among all age groups. In recent years, suicide rates among adults between the ages of 25 and 44 have surpassed suicide rates among the older adults, which are categorized on 65 years or older. And you can notice an increase on the 15 to 24-year-olds from 2014 to 2017. Regarding Hispanic statistics, suicide attempts on Hispanic girls is higher than whites, blacks, and Asians. 19% of Hispanic high school students have seriously contemplated suicide, and 13.5% Hispanic girls have attempted suicide at least once in their lives. Hispanic high school students report higher rates of suicidal behaviors, not death by suicide, but suicidal behaviors, than the general population of U.S. high school students. The percentage of Hispanic female students reporting suicidal thoughts and behaviors was higher than that of non-Hispanic white female students and also Hispanic male students. So talking about the last line of the 13.5% Hispanic girls having attempted suicide, well, this is compared to 7.9% of non-Hispanic white females and 6.9% Hispanic males. Regarding means of suicide, next slide. Males die by suicide more than females, but females make more attempts. And most males die by firearms. Most females die by ingestion of poisonous substances. So you see there that a little bit more than half of people who die by suicide, it's by firearms, and 27.7% suffocation, 13.9% poisoning. And that explains why most males die, even though more females attempt to die by suicide. Let's talk about risk factors. Some risk factors can be low self-esteem, social alienation, poor problem-solving skills, parent mental health history, dysfunctional parents' relationships, sexual abuse, neglect. Regarding behavioral, depressive, substance abuse, conduct disorders, self-injury, hopelessness, mood and anxiety disorders, and access to gun or prescription drugs, and stress from being different. For individuals who are already at risk, a triggering event causing shame or despair may make them more likely to attempt suicide. These events may include relationship problems and breakups, problems at work, financial hardships, legal difficulties, and problems with health. The risk increases if more than one of them are present. So for example, I am going through some depression and I lose my job, or if I am also having problems in my relationship at home. Next slide. Some life stressors for suicide risks are legal problems, medical and health problems, especially on older adults, intimate partner violence and other forms of violence, important loss such as a death of a loved one, lose a job, important relationships, personal humiliation, and bullying. These are triggers that can contribute for these risk factors. But now talking about warning signs. Warning signs, when you see warning signs, the person is already in ideation of suicide. That means immediate action is needed. Like, let's say, for example, if we would compare risk factors and warning signs to having a heart attack, risk factors would be high cholesterol and overweight, and warning signs would be, for example, feeling half of the body numb and chest pain. So people that are having warning signs are wearing a help me now, I call it, invisible button in their chest. So this would be, for example, the most predictive risk factor for suicide across a lifespan is having a previous life suicide attempt. So also talking about or threatening to complete a suicide, actively looking for means to harm oneself, sudden changes in behavior, especially following a painful event or loss, or even moving, especially for young people. Some elevated risks, that will be the next slide, is when viewed as different, a victim of harassment and discrimination, belonging to the following groups: LGBTQ, victim of bullying, gifted, returning to school after a suicide attempt. I was reading about around 10 different cases of young people who died by suicide, and I saw a common denominator, and that was all of them were victims of bullying. That was interesting to me. Now, talking about risk factors for Hispanics specifically, the SPRC have found that risk factors for Hispanics are alienation, acculturative stress and family conflict, hopelessness, and discrimination. Acculturative stress refers to the stressors associated with being an immigrant or ethnic minority and going through the adaptation process. For Hispanics who come to the United States, there are a number of significant stressors that are likely to be prevalent, intense, and lifelong. Factors such as the family's legal status, forced versus voluntary migration. Not everybody that migrates to this country is here voluntarily, and also perceived discrimination. The Hispanic-specific commonalities include generational differences and disagreements among generations regarding lifestyle choices and personal issues that might erupt into family conflict. The stress of being recent immigrants and reduced access to mental health assistance because of language barriers, cost of care, or perceived cultural exclusion. But after talking about all this, we can say that there are good news and that it is proven that suicide is preventable. People dealing with suicidal thoughts are also dealing with ambivalence. And there are protective factors that can build upon and strengthen so that people will be more on the side of saving and avoiding suicide. Next slide. Those protective factors we can, they summarize on behavioral health care, like if they have access to them, connectedness to individuals, family, community, and social institutions, life skills and problem-solving skills, self-esteem and a sense of purpose of meaning in life, cultural, religious, or personal beliefs that discourage suicide. And for most significant for Hispanic populations, they are strong family and community support systems, ethnic affiliation, spirituality and moral objections to suicide, and caring from teachers. In a survey nationally done, Hispanic adults who reported suicidal thoughts or attempts were less likely than non-Hispanic white adults to seek or receive mental health services. Familism is generally strong among Hispanics, and this is described as a strong feeling of commitment, loyalty, and obligation to family members that extends beyond the nuclear families. It includes making family needs a priority, or also extends beyond the nuclear families. It includes making family needs a priority over individual needs and being able to turn to family for support. Youth reporting strong, supporting relationship with their parents are less likely to attempt suicide. So Latin Americans tend to have a large, close-knit family. It is not uncommon for 3 generations to live in the same household or nearby each other. I've seen it firsthand. Grandparents typically play an important role in their grandchildren's upbringing. But alarmingly, 1 in 7 Hispanic girls living in the United States will attempt suicide after struggling with common factors, including culture, access to healthcare, family dynamics, language barriers, and poverty, according to SAMHSA. Perceived caring from teachers is associated with a decreased risk of suicide attempts by Latina adolescents. A spiritual leader and teachers are perceived as high authority figures in the Latino community. They are authority figures, a spiritual leader like a pastor, a priest, and also teachers. And regarding also culture, we can say definitely that culture is prevention. Latina adolescents with greater involvement in Hispanic culture have more positive relationships with their mothers and fewer withdrawn repressive behaviors and suicide attempts. In addition, ethnic identity is positively associated with self-esteem among Latino and Latina adolescents, and has been shown to moderate the relationship between perceived discrimination and depression. Individuals identifying themselves as Hispanic report higher scores on measures of moral objections to suicide and on measures of religion compared to people that are not Hispanic. They are also more likely than other racial ethnic groups who belong to religious denominations that have strong beliefs prohibiting suicidal thoughts and behavior. And within Hispanics like me, it is okay in general not to have a great deal of privacy. Like everybody knows everything and no or very little personal space. At the same time, researchers have found that Hispanics often share protective factors against suicidal tendencies, most notably the strong sense of family and culture that are often to blame in creating unresolvable conflict and leading to suicide attempts might just as easily serve a positive role in preventing them. In addition to recognizing the importance of the family unit over the needs of the individual, along with strong family support, pride in ethnicity, which has been shown to result in a lower risk of drug use. And as we all know, this is a suicide risk factor. And it's interesting to me that Hispanic youth who were born elsewhere but live in the United States have a lower suicide attempt rate than those that were born here in the United States. Next slide, please. Going over all these risks, all these factors, protective and risk factors, we now want to talk about being part of the solution. After we see people that are going or have some of these issues, of those risk factors, we want to help. One personal thing that I believe is very helpful is to listen. Be a good listener. Don't argue, threaten, or raise your voice. Don't debate whether suicide is right or wrong. Don't go into arguments with the person. Listen. Take time to listen and then dare to ask the question. For example, it sounds like things are really rough right now and I am concerned about you. Are you thinking about killing yourself, or have you ever thought about attempting to kill yourself? Share and persuade the use of resources that are available 24/7 and other accessible to the person, which we will be presenting in the next slide. And if the person needs immediate help, do not leave the person alone. Remove any drugs, alcohol, firearms, and sharp objects. Take the person to a mental health professional. Never keep talking about suicide. Don't keep it as a secret. You need to talk it out. So asking someone about suicide is not harmful. In fact, it's helpful. There is a common myth that asking someone about suicide can put the idea into their head. And think about this. You are talking to somebody that you are acquainted with. The person you're talking to is not a stranger. He has taken his time to talk to you, to open up with you, and you're listening and he's sharing. So you have to feel the trust to ask the question. Asking people about suicidal thoughts and behavior does not induce or increase such thoughts and experiences, not at all. In fact, asking someone directly, are you thinking about killing yourself, can be the best way to identify someone at risk for suicide. And of course, if the answer is positive, action is imperative. Something has to be done on your side. Next slide, please. Here we have 3 suicide prevention lifelines, and they are available 24/7, even in Spanish, even in a chat format. I did call the suicide prevention lifeline myself, and I did get a live person. I was able to talk to that person. I was able to ask her about her preparation professionally, and she was a professional mental health person. And they are very attentive. And even though I wasn't calling because I had a situation, I was just testing the system, and it works. Well, there are one specifically for veterans. Next slide, please. And it's 1-800-273-8255. And this other one, Trevor Lifeline, and the website for them is the trevorproject.org. This is specifically for LGBTQ communities, youth, and allies. So they are 24/7 in this 866-488-7386 number. They also have a chat between 12 p.m. and 7 p.m. Pacific time. And that is 3 to 10 p.m. Eastern time. You can also text Trevor to that number, and you will be receiving a message back. There is also a crisis text line, because there are many youth that don't like to talk to people on the phone, and they would have to text hello or say hi or help or something to 741-741. And it's free, it's confidential, and it's available for anyone 24/7. So there are resources available for free that will take people and help people on a 24/7 basis live. That is extraordinary. We have come a long way. And now let me talk a little bit about QPR Institute. It's available in English and it's available in Spanish. And it helps you recognize the warning signs of a suicide crisis and how to question and persuade and offer hope and refer someone to help. It trains the person on asking someone about the presence of suicidal thoughts and feelings, which opens up a conversation that may lead to a referral for help. So I'm presenting this one because I was trained as a gatekeeper for this program and train many people for free. And it is short and it's available, it's attainable. And it costs $29.95 for an individual online training. But they also have bulk online training in personal seminars, which are available. You can enter your zip code to find an instructor available in your area. So you would go to QPRinstitute.com and inquire more about this. And no education or experience is required to get trained. And during this month of suicide prevention, I was seeing that different counties in the United States were using this exact program to train the general public. I saw one in Oregon that they were training all public school teachers and also personnel from the county. So this is a great program that is not expensive and teaches people to identify these risk factors and how to question, how to persuade, how to refer a person to somebody that can help them further. So we are now in the social media era where so many people are into all this. And what if someone is posting suicidal messages on social media? On the left, you may see somebody saying, I'm sorry, God, please forgive me. I love you, Catherine. I love you, Dad. I love you, Mom. Though those messages are very clear that they are messages that are suicidal. Some are not that explicit, but if you know that person, you might, identify that something is not right with them. So there are places where you can get help, and here you can find for Facebook, for Instagram, for Snapchat, for Twitter, and for YouTube. And knowing how to get help for a friend posting suicidal messages on social media can save a life. Many social media sites have a process to report suicidal content and get help for the person posting the message. In addition, many of the social media sites use their analytical capabilities to identify and help report suicidal posts themselves directly. But when you access their help page, use the search term suicide or self-injury or suicide prevention, and it will direct you to more information on how they proceed regarding messages of suicidal ideation. And if you see messages or live streaming suicidal behavior on social media, it is okay to call 911 or contact the toll-free National Suicide Prevention Lifeline. One or the other, it's a good idea. If you can't reach that friend, or if you see that somehow you can help, something can be done. And now I would like to share a little bit about my CETPA experience working with suicide prevention initiative. One of the things that we worked on is creating from scratch the Gwinnett Suicide Prevention Coalition. It was started from scratch in 2011, and thankfully it stands strong today. I created the coalition and created it for around a year, and today the government body are all suicide survivors and actively work in suicide prevention. They have their own website and everything. We also implemented sources of strength in a high school and 2 middle schools. And we also created a youth advisory board team, which are heroes. We call them heroes. It was a youth group. And you must, in my opinion, it's a must, have young people, student age people in your meetings and planning. Teenagers, they are extremely valuable and creative. And how can I prevent teen suicide or help prevent it with no teenagers in my meetings? You can't do that. It can't be done. Latinos in general are avid radio listeners. We did a lot of radio presentations. We were able to use Spanish radio free of charge, and we aired a lot of live chats and shows and opened the phone lines, and we're very engaging in our talk show. We created from scratch a documentary with only $6,000. We can do a lot of things without having a lot of money, and that was our case. And this documentary aired in Univision in prime time. And most of the times that was aired, it was thankfully for free. We had the expertise of a person who has done documentaries for CNN en Español. And the most valuable person who helped us was Ivan de Miguel. I have his contact information in case you need it. He is very eager to help out and, in help with information or something. And he is currently a creative director of a Univision in Atlanta who charges nothing for all his work. And for that documentary, we found a Hispanic mother who lost her child by suicide and was able to give us a whole interview and in her house and everything. And Dr. Mancini was part of the documentary. Adam Lesser, who was the funder, was interviewed there too. And I don't think really that it's fancy, or I didn't even believe we would be recipients of an Emmy Award in the Southeast, but we did win in the documentary category. So as you see, we didn't have fancy cameras or fancy anything. And we didn't even have professional lighting or anything. So we worked mainly in a house, in a supermarket, in our offices, and in the field, in a park, and we do have the link here, which I will be presenting in the next slide. The other thing in my experience was being a QPR gatekeeper. It was very easy to become a gatekeeper with QPR. It is attainable, it is achievable, it is cheap, and you can do so much and reach so many people, because even though there are people that want to help, don't know how to. So you don't need to be a mental health professional to reach out to other people and try to help out by identifying those risk factors and persuading and, asking and persuading. The other thing we had was a CNN en Español special. We didn't have to pay for this either. They came to us. They did everything. We just were there doing our own thing. And we invited parents, we invited youth, and we had a chat, and it was very interactive. That is also a great experience. And we did YouTube presentations because most of all this stuff was done with young people, with a youth advisory board that we called Heroes, and a lot of work, a lot of knowing people, connecting, networking, and especially the Gwinnett Suicide Prevention Coalition that started by meeting one day and then inviting more people and bringing the medical examiner and bringing, experts in the field and starting a fundraiser. And we even had to did an activity to create our own name and find our logo. It was like little things, little steps, but we have come a further way. So in this next slide, you can see the link to the documentary, and it's in Spanish with English subtitles. And it was presented at Univision at the Nuestra Georgia TV program, but it was presented like around 10 times. And it's available for you if you are interested. And in the next slide, there are suicide prevention resources. Next slide, please. We don't have the time to play it because it's maybe around 30 minutes, but you can play it on your own time if you wish. And suicide prevention resources that I used for this presentation are those that you are seeing right here that are available to everybody. And American Foundation for Suicide Prevention is available in English and Spanish. It offers referrals to support groups and mental health professionals for those having thoughts of suicide, those who have lost someone to suicide, and those who have attempted suicide, besides of other information resources. One resource that I found very helpful is the Suicide Prevention Resource Center. It provides 3 resources to help you review evidence-based programs to work with suicide prevention. It gives you the 3 tools. One is the Hexagon tool, they call it, and it can help you select by reviewing 6 factors of the program. It also has a website to help you select evidence-based programs, and they describe it and identify and choose a part of a systematic planning process. And thirdly, they have another one that they call Community Toolbox. And this website offers free educational modules and tools addressing community assessment, planning, intervention, evaluation, and advocacy. But please always keep in mind some tips when selecting a program. Conduct a local assessment of the problem, risk and protective factors within the population you want to serve. Every population is different. The people that I serve might be very different to the people you want to serve. So what I did could be custom made for yours too, but there are some things that you have to accommodate. So number 2, you would assess the relevance, that is regarding, your population. And very important, you need to pay attention to outcomes and evidence ratings of the program you want to implement, and choose programs that match your population, setting, your culture, and that are feasible in terms of capacity, resources, and readiness to act. We didn't have a lot of money, but we did much because of connecting with other people and other organizations and other nonprofit organizations and even businesses and for-profit organizations. You have to be open, even churches and those sort of organizations. And for example, if the level of readiness of your population is in denial, which is a very low readiness level, well, that means you can't work on policy change, for example. Like you have to work according to the readiness of the population you're going to serve. You can't, for example, do this great suicide prevention conference if the population you're going to be inviting is in denial, thinking they don't have that problem. You're going to have to go a lower key, like maybe messaging campaign, low key, with a lot of information dissemination first. So there are other resources for suicide prevention. Next slide, please. And there's a Hopeline Spanish-speaking crisis hotline. Know the Signs, also in English and Spanish. My 3, that's a cell phone app. SAVE, which stands for Suicide Awareness Voices of Education. It's also in Spanish. Each Mind Matters Suicide Prevention Brochure in Spanish is available, and NIMH Suicide Prevention Resource Center in English and Spanish. So Hopeline offers a free suicide prevention and crisis intervention helpline for adolescents, teens, and adults in Spanish, and that is from 8 a.m. to 12 a.m. daily. Know the Signs is also available in Spanish and offers an interactive tool for third parties to help recognize the signs of suicidal ideation and helpful phrases for talking to someone about suicide. Like if you feel like you need to know how to talk, how to start a conversation on suicide, this would be a nice one. And My 3 offers a downloadable app that creates a safety plan for those experiencing suicidal thoughts, including whom to contact when having a suicidal ideation. Also in Spanish, is recommended by the National Suicide Prevention Lifeline. Next slide, please. And you can go to mentalhealthfirstaid.org. Again, mentalhealthfirstaid.org to find a course, find courses and training, find an instructor available in your area. by entering your zip code. Completing a mental first aid training was required by all employees at my job site at least every other year. And it's around a 7-hour training, very worth every hour of it. It's amazing. And it includes the training and the book. Another program that is evidence-based that I want to present to you that I implemented in 3 schools in Gwinnett County is Sources of Strength. It is designed to build protective influences around youth and to reduce the likelihood that vulnerable youth and young adults would become suicidal. And I have something special for you in case you're interested. This thing works. And I do have the job cell phones for the founder and the president, and for the executive director, Mark Lomore. He's the founder and president, and Scott Lomore, he's the executive director, in case you are interested. If you look up at sourcesofstrength.org, you will not find their phones, but they are available if you need them from me. And Sources of Strength is most often implemented as a school-based program in middle school, high school, and college. And but it can also be used in community and faith-based and cultural settings. It promotes and focuses on connectivity, school bonding, peer-adult partnerships, and help-seeking behaviors. I remember working a lot in the 3 schools with a lot of messaging. We had a big board on the hallway where all this traffic of students would pass by, because having a board inside a counselor's office won't work, but having a big board on a hallway with all the traffic, it's basically a very good tool, and you would have to change it at least every 2 weeks or so. That's what we did. And again, students are the most valuable resource to doing this. The most creative minds there are them. And we trained peer leaders, and they would network with their friends, with other students, and we trained them to have one-on-one conversations to develop hope, health, strength, posture, and our PSA program using local faces and voices, people they knew. The pictures and the people we portrayed in our messaging by media or, on the boards or however, they were all people that were from the school. They were people they were familiar with. And we did presentations from peer to peer. It could be in the cafeteria. It could be during their classroom hours. These presentations were around from 5 to 10 minutes. And thankfully, we were able to do them in health classes and art classes and things like that. We developed videos and PSAs on YouTube, texting messages, and announcements on, public announcements on the school in the morning. And as you see, Sources of Strength is very strong in building relationships and messaging. This is a strong core of this, and this right there is very inexpensive, in my opinion. And the program is often initiated as 3 to 6 month project, but you can designate a multi-year project with ongoing peer messaging and contacts growing over time. So in our case, Sources of Strength was like a 3-year deal. And as I said earlier, you can implement it in a church, in a community's office service, and it works fine. It has been proven to work. And I would like to present to you one little short video by Sources of Strength. And this Sources of Strength video, we are presenting the 8 strength factors that is used in source of strength, like family support, positive friends, mentors, healthy activities, generosity, spirituality, medical access, and mental health. We say that if a student has at least 4 of these 8 sources, they are to be strong, they are protected. But the fewer, well, the worse it is. So let's watch this very short video, please.
There can be many reasons why someone can lose their purpose of living, but only a few are needed to strengthen it completely.
So as you see, we didn't talk much. It was more like watching and seeing each of those sources of strength being presented in a visual way. And these students were part of the Heroes youth group that I talked earlier. And at the end, always try to include in everything you do the Lifeline number. Before we used to use just Lifeline number, but now we have available like chats and the other ones that I presented earlier. And dealing with ambivalence, that for me is very interesting because that puts all of us in a position that we can say everyone can help. And I was watching this video today about, it's called TED.com, and then there is like maybe hundreds of topics, and I clicked on suicide. And there is this guy, Sergeant Kevin Briggs, and he patrolled the south end of San Francisco Golden Gate Bridge for 23 years. And well, this presentation alone has almost 5 million views, and it's translated to more than 30 languages. You can have it available. It's a little less than 15 minutes. It's available like for you to, an icebreaker and start talking about suicide in a positive manner. And even though over 1,600 people have died by jumping off this bridge, he was involved in hundreds of mental illness and suicide calls around the bridge. And the great news is that the vast majority of folks that are contacted at the bridge change their minds and don't jump off the bridge. Well, he states that the very few have jumped. He said that during those 23 years that he encountered hundreds of people that only two jumped from the bridge and died. But there were a few that lived and can talk about it. And most of those folks have said that the second that they let go of the rail, they knew they had made a mistake and wanted to live. People dealing with suicide thoughts are debating whether or not to die. They just see the easy way out. They think this is the best solution that will end all. But you can be that person who opens the door for the life option. So I leave you with this thought, and thank you very much for this opportunity. We can now open the questions. If somebody is interested in making a question, please.
Thank you so much, Deanna. I really appreciate all the information that you've brought to us. We have had a few questions posed to us at this moment. One of them was where the video can be accessed, and it was placed in the chat box. So if you don't have your chat box open, the link to the video is on the chat box. And then the documentary, Deanna, do you know if we have a link for that documentary or where people can watch it?
Yes, we do have it available, and actually the slide I had was just the link, but somehow you can see it, but there's a link and I can provide it.
Okay, so we'll ask our IT folks to go back to that link and make sure that that goes in the chat box or in our Q&A. There's a question coming up saying, what are some ways to start talking about suicide with populations that are in denial?
People that are in denial, that's you. When I was working with the Alcohol Prevention Project, that's the readiness level we were. So denial means a very low level of readiness. That means that you have to start in a very low key. And the lowest available that has worked, proven that has worked, is information dissemination. You really want to do so many things and change people's perceptions and everything, but you can't do that. It has to start very low. It has to start by maybe a positive message and hope, and having information available about resources that are available when this kind of problem arises. So it's basically messaging in a very low key in terms of information dissemination.
Thank you, Deanna. Another question is, when you talked about the Suicide Prevention Coalition, there are coalitions that want to reach out to Latino communities and they just don't know how to do that. And I know that you worked in helping some coalitions recruit members of the Latino community. Can you tell us a little bit about some strategies that you use to help coalitions work with individuals in order to serve Latino communities?
If I want to serve Latino communities, I have to have Latinos in my coalition. There is no doubt. Like, for example, if I want to serve young people, I have to have young people sitting in my table, making decisions and giving suggestions and opinions. It is difficult because you would have to translate. You would have, if they don't know English. And we did have that situation in one of our coalitions where we had people who didn't speak English, and our coalitions were in English because most of the people didn't speak Spanish. So you have to have Spanish folks and somebody that translates for them, and they have to feel included. You have to participate in events that are directed for them. You have to be available to sit on coalitions that do serve and reach directly to Hispanic populations. It's maybe a slow process, but it doesn't work outside not having to go to, in a sense, through the trouble of translating. And they have to sit in your in your meetings, and also networking and serving with other coalitions that do reach out to them, even though it's not directly related with your purpose of your coalition.
Thank you so much, Deanna. Another question, what do you recommend to reach out to parents of adolescents in schools to initiate discussion about suicide?
If it's with Latino parents, that is very easy, because teachers and school administrators, they are authority figures, and parents would just be elated to be invited and come and serve, and that is very appropriate and very, in my opinion, kind of easygoing with Hispanic parents. And if the letter, the invitation has to come, of course, in Spanish. And in Meadow Creek High School, we, besides sending the letter with the student in Spanish, we would call them. We would make a Spanish phone call. It's a lot of trouble, but we have voluntaries and students that would help us do that. If it's only parents that are American or that are not Hispanics, that is a different story, and that has to be worked out with the youth. They are very creative, and they are very eager to help if they feel they are heard, if they feel that their suggestions are important and are heard. That's what I suggest.
There was a follow-up question about sharing Deanna's contact information, and there is a slide coming up that will do that. So another question that's come up has to do when you talked about the Heroes group. So can you talk a little more as to how you were able to get young people involved, and what kind of activities did these young people end up doing for you in your program?
Okay, it was not difficult, I have to say, to find them, because at CETPA, we work with schools, and we had an after-school prevention program. But really, recruiting was basically finding 2 or 3 that were very active, students that were wanting to volunteer, that were sitting in our meetings, and then they helped recruit the others. Recruiting was mainly done by themselves, and also I have to say that they were rewarded. It wasn't just they had to work and do all the work, but we offered them some fun activities, which were basically we gave them food. If you have teenagers, you have to have food, even if it's junk food. And also, they had to feel valued. We invited people to talk to them about things they really want to hear about, and we did fun activities like games and watching a movie, things like that. They were mainly involved in doing recruiting and messaging campaigns. They were the ones who did the videos. They were the ones who reached out to other members and maintained the group. The meetings we had were mainly directed by them.
Wonderful. There is a question about acculturative stress and being a risk factor and acculturative risk. How do you feel that acculturation plays a role in when someone has to reduce their cultural identity in order to fit in with local community? Is that associated in the risk of suicidality for Latino communities, the role of acculturation?
Acculturation is a very protective factor for Hispanic folks. And being able to identify yourself is part of being who you are, is building upon your self-esteem and the security of who you are, where you come from, and it provides also some pride. So I believe this is a very important protective factor, and I really, how can I say this? It's very important to build upon that, and for Hispanics, that is a very important factor.
Thank you so much. Sources of Strength is a peer program. How did you adapt Sources of Strength to a Hispanic population to make it more culturally appropriate?
As you know, Sources of Strength is basically connecting peers with peers and also young students with adults. So they are the ones who pick who that trusted adult is. So this goes beyond any culture. Like if you trust someone, you will want that person to be that trusted adult, and that connection is built in Sources of Strength. So there were most of the students would just invite the person. We had a process of doing this, and the adult would accept, and it in my opinion it worked fine. It would work fine with any culture, because we did like the messaging based on what they thought was important and was their ideas, and they were being feeling important because their suggestions were taken in consideration. So when they see this happen, it doesn't matter if you are Hispanic or if you are of another race, because it just makes the train keep moving. So it's just taking them into consideration and keeping, Sources of Strength based on messaging that is important to them, based on what they need and based on what is the risk factors and the factors that they are going through that would serve that specific population. You are like the guiding person, but they are the ones who provide the tools in a way, in terms of what is going to be said and how it's going to be said.
Thank you, Deanna. So there's a question about social determinants of health. Can you speak about the impact of social determinants of health on increased risk of suicide among Latinos? And maybe, Deanna, you can start by telling us a little bit as to what are the social determinants, what are those categories, and then what is the impact of those on the increased risk of suicide?
I would say that there are at least 6 determinants of health, which are economic stability, that includes employment, income, expenses, debt, medical bills. The second one is neighborhood and physical environment, and that has to do with housing, transportation, safety, playgrounds. Education, that has to do with language, literacy, early childhood education, training, higher education. Food, and that has to do with hunger and access to healthy options. Community and social context, dealing with social integration, support systems, community engagement, discrimination. Healthcare system deals with health coverage, provider availability, quality of care. So the risk that has to do with any of these determinants of health increase if you lack of them. Like, for example, if you have issues with employment, with your income, with a high debt, with medical bills, that puts you in a risk, in a in a position where you would go through some stress and anxiety. If you add to that your education is low, that would also be a stressor in your life. If you are lacking food and access to healthy, uh, to, to, to a doctor, for example, that puts you in a higher risk. And if, for example, you are not able to speak the language, you are not able to, um, you are being discriminated against, that puts you in a higher risk. That is my opinion.
Thank you so much, Deanna. Very, very important question. There, a question about clarification of the higher incidence of suicide attempts with Latino adolescents born in the United States versus those that were born elsewhere.
Um, I don't have the answer of knowing why. I just figure out why, to be honest. Like, for example, if you were born, let's say in Mexico, and you come here, you already have your roots, your identity, you know where you come from, you know how it looks like, you speak the language, you were interacting with family members, with maybe first, second, and third generation of your family members there, and you just come here, you already have a foundation. But let's say you come here and the only person here, I've seen cases like that, is only you. You were sent, you were born here, but you don't know your ancestors. You've never seen your grandparents, and sometimes you've never seen one of your parents, and you were born here, and the person you are living with is undocumented. So there is not that great facility for you to go back to your country and know those people and get related in a more, connected way with family and culture. So in my opinion, that's why, lack of identity and lack of strength with family members that go back to maybe your second generation grandparents and that sort, that'll put you in a disadvantage compared to those that already come here with a solid foundation in terms of their identity with culture and other family members.
Thank you. There is also some research, and we can see if we can get some of that cited, that does seem to support that statistic. I know that Dr. Aguilar Gaxiola has put out some research that states that Latinos do come to the United States with better mental health status, and the longer that we're here, that seems to deteriorate. But with suicidality, there seems to be some research that does support the fact that US-born Latinos have higher incidence of suicide attempts than foreign-born Latinos. Okay. Well, we seem to have come to the end of our time, unfortunately. Deanna, I want to thank you so much for your time and expertise. If we can have the next slide, please. This presentation reminds us, suicide is very real to us. As you know, we are celebrating Suicide Prevention Month. We have to remain vigilant for everyone that we live with, we work with, we play with, and we pray with. Suicide is something that is extremely important, and we have to be able to continue to educate and continue to be alert. Here's Diana's information for those of you that want to follow up with her. Next slide, please. For more information about the National Hispanic Latino Prevention Technology Transfer Center and to request any free training or technical assistance, you can reach us at the information that you see in your screen. Next slide. And as I mentioned at the beginning, we do have an evaluation that is extremely important for us, and we hope that you take the time to complete this evaluation. After you complete the evaluation, you will be able to receive the slides, and this presentation will also be available at our PTTC website, and then you'll be able to access it at any time. And then in a few weeks, you'll be able to access the slide in Spanish and in Portuguese. At this time, I thank you for attending our presentation. Gracias por atender nuestra presentación. And obrigado por particular de esta presentación. Thank you so much.